actually involves so many questions, and in fact, it is the major aspect of pediatric dentistry that gets asked in the exam. Hi, Dimple. Hello, Esther. Hi, Muna. Hi, Sneha. Good morning, Dimple. Hi, Saida. Hi, Hamid. All right, so as I was discussing that today we are going to be talking about the oral health and disabilities in children, and the assistance animals that they may require to bring with them during the clinic. So we have been having recent questions about it. So what I was also thinking about is that, as I announced, that we will soon be having the cluster specific mocks. Probably by the end of this week, you will be having on the app both the crash course as well as the full course. The fully available cluster specific mocks will be made available by the end of this week. So today only, when I calculated all the questions, seems like we have more than 2,500 questions combined, and that's why the new health promotion and professionalism mock is also under making, which will also be released very soon. I will announce which part of the week it will be added. So more than 2,500 questions are there, including all the four clusters, which is information gathering, your diagnosis and management planning, treatment evaluation, and then health promotion and your professionalism. So all the four clusters combined, if we have about, say, 2,500 plus questions, so each cluster, maybe some of the clusters are really higher on the number and the volume of the questions, which also goes out to show that what is the ADC's distribution. So not all the four clusters are equally asked. There is still density of certain questions. There is still more number of questions in particular cluster. So I've analyzed those numbers as well, and it looks like the information gathering, because those are the first one or two questions with each SBQ, are the highest in volume, and then is your diagnosis and management. So these, when you have 5 questions per SBQ, right? When you take ADC questions and you go for the examination, you see 5 questions per cluster, per SBQ. So in those 5, usually the one or two get asked about the information gathering. So first 3 are heavier on diagnosis, information gathering, management planning, and then treatment evaluation and professionalism and health promotion. So although professionalism and health promotion is increasing in the percentage, but it is still not as intense as the other 3 clusters. And that is exactly what I also talked about in the last class, last to last week's class also, what to focus on in the 12 weeks preparation. And I did emphasize on the fact that do not go super intense and just focused on one cluster. You cannot have a unidimensional preparation. You have to have a holistic preparation for the ADC exam to crack it. All the 4 clusters will determine your outcome. And even if you have struggled with one clusters previously, in the examination, the intensity and the difficulty level can change per cluster each time. So you have to go prepared for individual cluster with equal intensity and equal level of depth. Does that make sense for everybody present here? So today's topic I am going to be talking about, it's predominantly professionalism and health promotion, because children who have oral health and disabilities, they are more likely to develop oral conditions which are contributing towards their systemic conditions, and that's why a preventative approach is super important for them. As a dentist in Australia, what's your role? How you're going to handle them, manage them, and provide the care, promotion of health in them. and involving their families and guardians, because there will be multiple people involved in their care. So where is your role? What is your understanding and knowledge base that will help addressing such patients in the most wholesome manner? So it is predominantly going to touch the professionalism, the health promotion aspect, but still it will, today we will also cover about information gathering and diagnosis and management, what to expect, what oral conditions will you be expecting in these patients. Does that make sense? So it is heavy on the professionalism and health promotion side, but yet I will never leave other clusters untouched whenever I'm covering the most crucial ADC topic. So we will still talk about what is the information gathering, what will you expect upon examination, which disability will present with more of what oral conditions, what are the challenges these patients have, what predilections they have, and what are their risk factors, right? And where your role comes in. So management planning cluster is also included in this today's topic. And in information gathering, what are the findings that you are going to expect will also be included in today's topic discussion. Along with that, what are the diagnoses? What are the dental diagnoses that you would find here? Are you able to send messages on Zoom? Can you just try again? I think if the chat is working or not. Yeah, okay, perfect. So is it making sense that we will still be talking about the other three clusters in today's discussion? And after covering today's topic, I will also be taking one SBQ, which will help you, encapsulate all the concepts that we are going to be talking about today. So first we'll focus on learning, which will include all the four clusters. And then we will apply this knowledge and the concepts that we learn to an SBQ. Okay. If you're on Facebook, you can drop me questions on Facebook or on Zoom. I'm checking both the chats as well as I can, but I will focus first on explaining the concepts. Try to receive as much information as you can first, and then eventually ask me questions. I'll ask you questions towards the end as well. All right, just to make the screen. All right, so we'll start with oral health and disability in children, and we'll later cover the assistance animals, what are the three categories, and what Australia allows in the clinic, what is not allowed in the clinic, so that in the questions, in the examination, when you have questions for all the different kinds of categories of assistance animals, then how are you going to approach that, what you're going to allow, what you're not going to allow. So basically, why this is an important topic is because pediatric dentistry is one of the disciplines that get asked a lot. Pediatrics and orthodontics is increasing in percentage. Again, one of the takeaway points. I'm going to also, when I cover today's conceptual class, so please know I will be giving you concepts, but I will also be talking about how this applies in exam. I'm going to tell you clinically the relevance of this question in the clinics, but also for the examination point of view. So try to keep your notebooks open and keep notes and keep taking notes, especially what gets asked in the exam. So when you're revising, and this entire concept, this entire topic has been fully covered in your hot notes. So pediatric hot notes have been provided to you if you're enrolled with us. And this entire topic is in full depth covered there. So consider it as one of the revision class also of that hot topic. So overall, all the children, whether they have disability or not, their good oral health is important for their overall systemic health. We have seen in a lot of adult patients as well, a lot of cases where the pregnancy is given in women. So there also these kind of questions get asked where the oral health and the systemic health is linked. In senior patients where there's cardiovascular health associated, then antibiotic prophylaxis relevant. So in therapeutic guidelines also, in the examination also, again, very exam specific concept that the linkage between the oral health and the systemic health is getting asked a lot. So you must know how your oral health affects the systemic health and what's your role as a general dentist there to prevent it so that their overall systemic health can be improved. And especially ADCs focusing on the vulnerable populations, on the less privileged populations. So again, indigenous population comes into that, senior population comes into that, and the children with disability also comes into that. So again, exam relevant concept that the vulnerable populations, underprivileged populations, they are getting asked in exam. My every concept will include now the emphasis on what is getting asked in the exam, so you know that whatever you're reading and learning today is directly going with you towards the examination center, right? So most of these patients who would have mild to moderate disabilities, you can successfully treat them in your clinic. There is no need to refer them to the specialist setting or your hospital settings. Mild to moderate disabilities can be treated, can be handled in the general dental clinic, although there are certain protocols around it which you must apply, which you must, take care of when you're handling such patients, whether it's your behavior management, whether it's when you have to plan their appointment, what kind of consents you would be requiring, emergency treatment, and the detailed treatment plan. All the kinds require some protocol, but yet can be handled by general dentist in general dental clinics. So you have to also remember and keep in your prognosis and as an outcome expectation of any treatment that you provide them, that there is going to be some poorer outcomes. There is going to be some prognosis effect compared to children without disability. So these children with disabilities also present with a challenge for you that there are going to be certain poorer outcomes. So you might have to plan extractions instead of fillings, right? Or if you see periodontal disease in them, especially because periodontal disease is rarer in children, especially the true periodontitis, but in these children with disabilities, because of compromised and poor oral hygiene, there is going to be intense periodontal disease as well. Does that make sense? Give me yes and no's in the chat so I know that you're getting all these concepts. These are your actual exam concepts, actually getting applied to the exam questions. So your prognosis gets affected, like your treatment planning gets affected when you do it for patients who are going for your radiotherapy or for your MRONJ. Similarly, high risk patients, similarly in your disability patients, your treatment planning should keep the poorer outcomes in mind whenever you're planning the treatment plan. So all these, so there is definitely increased requirement and increased need in such patients because of the, if you compare it with your general population, because they are your vulnerable and overlooked population, right? There is no self-care involved, there is no self-awareness involved, and there is so many other therapeutic interventions that they're going through. They're going to other healthcare centers to get other helps and assistance. So parents are also under pressure. There is a lot of pressure on the family also. So of course the oral health is compromised. There is not as much attention and focus on the oral care. Is that right? Because of their other therapeutic requirements, there it would be a challenging case. So that means if the families are also pressured, there's also no self-awareness or self-care from the child's aspect as well. So your role as a general dentist becomes even more important to fill those shoes, fill those gaps. That is why it becomes a more professional and a more health promotional situation for you to handle as well, right? So these kind of children would have certain intellectual disability, certain physical disability. There could be different challenges presenting, right? So there would be some challenge in communicating with them. There would be some challenge, of course, with consent. And sometimes consent may be given by their parents, guardians, and sometimes other healthcare workers may also be involved. So when you are taking history, information gathering cluster, crucial point, whenever you're gathering history, You will be also focusing on who has the legal authority to give consents. There could be multiple figures in such cases who can give consents, because parents may not be able to go to every healthcare appointment, and then they may have a proxy consent giver as well. So when you're collecting histories, would you focus on that as well? We'll come to that, DJ. Don't worry about it. We'll talk about Jay, what I'll do. Let's just start with where we are at. So let's not jump the guns, but initially let's focus on when you're starting with the information gathering. So any such questions, any such disability patient questions and SBQs, when they will come in the exam, they will start with information gathering and then go towards the management planning, treatment, and evaluation. Okay, so let's talk about the information gathering thing. Number one, it starts with consent. So you have to start investigating and asking whoever is accompanying the patient that who has the authority to give consents, right? But still, no matter how much you are prepared to handle these situations, there will still be some barriers that will always be present while treating these patients. Agreed? There are going to be some barriers which, no matter what, how fully you are prepared, you will face them. There is going to be heightened anxiety from the child, sometimes, if there are parents involved, from them as well. There will be multiple support networks involved. There would not be just you as a primary healthcare giver. There will be GPs, there will be other therapeutic healthcare workers which will be involved in the patient's overall management. So you might have to connect with the multidisciplinary team also sometimes to handle the patients, right? Then you will also see that they are not going for dental care very frequently. Their oral hygiene is also not up to the mark. There may be missing oral hygiene practices also. So all this will be involved, right? You should be prepared for these challenges as well. Isn't that right? There will be infrequent dental care, which of course from your end the motivation has to come. From your end the education part has to be even more. And then you cannot complete all your treatments that you're planning for that child in single appointment. You will have to have a series of appointments. You might have to do smaller appointments, do smaller treatments, and then recall the patients in their suitable environment and suitable timings. So all the four barriers and challenges, they are covered, because these barriers will help you go with the diagnosis and management planning cluster. Clear for everyone? These barriers will help you in your DM cluster, diagnosis and management planning cluster, because management planning cluster include questions on that how will you behaviorally manage the patient, right? Whether you require the initial communication methods, nitrous, whether you can use or not, right? Then which other team members, which other disciplines and specialists you have to involve, what should be the timing when you plan the appointment. So those are all management planning. Is that right or wrong? So in how many appointments you will do, what you will do on the first appointment, what you will do on the next. All these aspects, I'm going to now give you how to choose answers on that, but these barriers will decide your management planning, right? Now, there have to be certain requirements in these patients. These patients would have certain challenges. There will be more medical problems associated with such patients. They will have more medical situations going on for them. They could have epilepsy underlying, vision and hearing impairment. They could have difficulty eating. Malnutrition can also be the challenge because of inability to swallow, chew properly, or obesity because of the metabolic disorders, reflux disorder, constipated, then skin conditions, cardiac, endocrine, all kind of pathophysiologies are possible in these patients, right? So you have to be mindful of what is the underlying medical conditions. Is that right? So you have to be aware of the medical history, information gathering cluster here. All these information will help you manage the patient well. Now, also they would be at a greater risk of mental health issues as well, right? Because of their own conditions. They may have even unrecognized and untreated health conditions, which, as a primary general dentist, for them, it is also your responsibility to take complete history. So, if there are any unrecognized health conditions, that also you can identify, right? Then the medication history, the drug history you will collect. This is important. This is all information gathering cluster. As I said, no matter any topic can be heavy on one cluster, there's still the SBQ will have all the questions from all the four clusters. So these are the ones that you will be focusing on for information gathering. Collect all the information on the drugs that they're taking. Usually children would be taking more syrups. They would be, and if there is a cardiac condition or any other GI condition, respiratory conditions, the drugs would be also stronger, which have a lot of side effects. And the certain drugs can give you oral complications. We'll talk about that. So they will have lifestyle risk factors, deficiencies, nutritional disorders that also you might require to involve the dietitians, nutritionists, right? Then there's obvious communication difficulties. So behavior management has to be applied. So we have done and covered the behavior management article entirely, what to prefer, how to sequence. So rash technique will work when you know the articles and the sequencing of everything. Isn't that right? So every technique of behavior management may be applied while you're planning the treatment, while you're executing the treatment, but rash technique will come in handy when you know the sequencing. Is that right or wrong? Yes? So please understand that all the other articles that you have prepared, all the other hot topics and hot notes that you're preparing will, again, it is a self-feeding loop. All this preparation from various hot topics is a self-feeding loop. And in examination, every SBQ will require you to connect the dots from all the hot topics and all the hot notes, right? And then accurately, you apply all that information, and how you process it simply by applying the rash technique, okay? So there will be also challenges with their financial resources. So we'll talk about the insurance plans which are available in Australia for such patients, and the questions can be coming from them. So you must know the insurance plans. Then you have to apply health education and promotion for them, because there would be having some lack there. So parents will also be required to be educated, because you can't educate the child in this case, no matter the age, also because of their intellectual barriers. There will be also delay in getting the primary dental care. So you have to educate them about getting the timely dental appointments, regular assessments, regular evaluations and recalls. You must give them calls and remind them, again, very repeatedly asked question. Correct? So you have to understand the challenges of such patients, how they can present, and what is your role. So your role is identifying the drugs, identifying the medical conditions which are already they are aware of, and also focus on identifying the unrecognized medical conditions, the lifestyle challenges, the nutritional disorders. Everything has to be assessed, acquired, information should be gathered when you're collecting history for such patients. So, as you know, there is a well-established link between the oral and systemic health. That is clear for everyone, right? Why we are focusing so much, why there is a cross connection, why we are focusing on the systemic health, medical conditions, and drugs, because they affect the oral conditions. And the oral conditions can present the systemic challenges. So, unrecognized and untreated conditions can also be start developing because of the existing oral conditions. And poor oral health can increase their further risk of cardiovascular disease, diabetes, and other chronic conditions. So education, identification is extremely important, right? So what are this is their overall history that you would acquire. So far so good. The information gathering cluster, what you will look in the SBQ, what are the keywords which you will highlight, which is required to connect the dots and choose the diagnosis, choose the management plan, choose the treatment and evaluation. So far, so good for everyone. What you're looking for as keywords in the SBQ. Now, what can be the conditions and adverse effects which can be experienced by such patients? Those will be your chief complaints in the history of the question or not? Is if anyone who's enrolled with me and does internal classes with me, you know we have a process, you know we have a system, how we understand and learn and break down an SBQ. Is that right? Give me big yeses if you know our system, the RASH technique, and then looking at an SBQ, breaking it down, the keywords, connecting the dots, and the RASH. So these are the building blocks that we focus on, right? This lecture now you're seeing is actually focusing on each building block one at a time, right? So every article that you have done, every hot note that you prepare is also built like that. First, it helps you understand the connecting dots. What are the dots? What are the things you're going to identify in your history? When you read the SBQ well, that's your half job. It is the most important part of attempting ADC SBQ, reading the history well in exam. Anywhere you make mistakes during those moments, your answers will get affected. So your history will include some very important medical histories, dental histories, drug histories, and then there would be a chief complaint. Again, the hero of the SBQ, which feeds our diagnosis and management planning cluster questions. Yes or no? I've taught that technique also to you. We know it all, right? So you know the process, you know the system. Even the ADC exam is a system. It's scientifically solvable. You must know the system. You can't do vague discussions. You can't just vaguely talk about concepts. There has to be how to even process information, then assimilate it, and then apply it to question. There is a scientific method to it, a thinking method to it. Okay, so now the chief complaint feeds your diagnosis and management planning cluster. So let's see, such patients can present with variety of chief complaints. So how you're going to address it, how you're going to first focus, and then know that what could be the etiology. Etiology questions repeatedly asked in exam. So one of the challenges could be these patients can come with a chief complaint of difficulty in chewing, right? And those could be, those could lead to, because if their problem is difficulty in chewing, then they can have inadequate nutrition, right? Their diet can also be modified. They may not be able to chew hard food, so they may be on liquid diet, soft diet, and that can move easily towards a cariogenic diet because it would not be a self-cleansing diet, right? So they may require meal alterations. All those things can present challenge, and there is also a potential and a hazard for choking and aspiration. So they could be nil on mouth, right? So there could be very limited intake of food and meals. So calorie intake can be less, nutritional deficiencies can be there. It could be easily a cariogenic diet, and there could be food impactions leading to localized perio problems as well. So that can lead to increased dental decay and tooth loss. When that happens, it will affect their speech, their appearance, again, their language development, right? It can lead to halitosis, how they are socially included, how they are participating in their social interactions, that all gets affected. So oral health affects your systemic health as well as your mental health. Pain and discomfort can be the obvious sign when the decay is extensive. Then they may be on a lot of medications which could be sugary, so that can lead to direct caries. But also there can be systemic diseases which lead to, the drugs can lead to dry mouth, xerostomia, hyposalivation, stains on teeth, and gingival enlargements. Epileptic drugs, they could have cardiovascular diseases, so they could be on calcium channel blockers as well. Again, Gingival hyperplasia is a common side effect of certain drugs, which can be easily seen in children, right? Then the acidic medications, the pH, if they have asthma, they're taking their bronchodilators and the pH is low, the erosion of teeth, plaque accumulation, periodontal disease like gingivitis, periodontitis, extensive caries experience, soft tissue diseases, lower saliva can lead to also mucositis, altered taste sensations. All the side effects of dry mouth can also be seen. When the caries progress, because they are not going to dentist very frequently, the extensive caries experience can also lead to extremely painful situations, necrosis of the pulp, irreversible pulpitis, and in those situations you can require to do emergency treatment, which can be even more challenging because there would not be any familiarization for the patient. They may be brought in for immediate pain, then you have to handle them in emergency as well. Clear for everyone? These are your possible chief complaints and their underlying etiologies. So far, so good. So is it coming to the view? The full understanding is coming. Are you seeing the bigger picture now of this patient and all the 4 clusters that it can get asked as? Now, in the last 1 year, both the examinations are going full blown on this topic. This is the hottest topic for ADC exam, considering the last 2 examinations. Okay. So there are still more ADA policies on this, right? I've tried to include in this one all the Australian guidelines and ADA policies as much as I can in the hot topic. And I'm creating newer questions and mocks also on these ADA policies. So you are going to be practicing more questions on this concept particularly. But again, it will not just be health promotion. It will always be information gathering, diagnosing, giving treatment, and then doing the health promotion and handling it professionally. Now, their adult caretakers may also get involved because of their conditions, right? Some of their conditions can be transmissible. So they can be leading to, or if these children and young people, as they grow in age, they can also have risk of aspiration of their own oral bacteria as well. So the aspirational pneumonia, recurring infections, and respiratory challenges increase as these children they grow older, right? So when you're focusing on interacting with these patients, acquiring history from these patients, your focus should not just be the patient, but also the patient's family support system, and your relationship should expand to that because there is a requirement of more frequent dental visits, more assistance from the parents is needed, and the parents are already burdened with the child's care and other appointments. Your role to educate them, support them, and encourage them for regular health appointments, oral health appointments, is necessary. So your challenges are because these patients require extra support, and there is psychological component involved, social component involved of the families. So your communication and your collaboration with the family is the most powerful health promotional tool. Any options, any questions on professionalism and health promotion that comes to you will challenge your skills to know which is the most important way of handling these patients. Do you all agree with me on that? Give me big yes and no's that your health promotion and professionalism questions will test your skills on communication and collaboration with their patients, family, parents, or other healthcare workers. So when you're given multiple options and there are other tools to work with, we have had questions like that in exam during the school test also, school dental, surveys. Different tools options are given. Please know communication is the key to answer such questions. These are all soft skill questions. There is no hard skill involved. How much tooth preparation required? How much deep you must go to remove the caries? Are these hard skill questions which you have the answer straightforward? These are not such hard skill questions. These are soft skills which, with your consistent health promotion preparation, by doing ADA policies, by doing health promotion articles, by watching all my health promotion article classes, you are slowly learning. When you watch the code of conduct classes, are you not learning those soft skills? If you watch my code of conduct classes, both crash course and full course have that. I have covered and explained it, not just read it out, but I have explained it how to even apply code of conduct to the exam question, how to choose between different languages of the options given in such clusters. So I'm also giving you scientific references. I'm also giving you the guidelines and the latest criteria for treatment, investigative tools. But then I'm also training for the health promotion and professionalism cluster by teaching you the soft skills, by choosing and reading the statements and understanding which is the most effective communication method. Does that make sense for everyone? Give me a big yes if you understand the relevance of it. Without it, you cannot crack health promotion cluster. So watching my code of conduct classes twice, learning those skills when I give you CV classes, special topic classes, important article classes of health promotion articles, of ADA policies, and when I show you how to read between the lines by your suggestions in the policies, and then how you can find those in the exam questions. I keep showing you those links. I keep fine tuning you to identify those key communication methods. Okay. So here also the most important is in such patients, your health promotion focuses most on collaboration and communication. Collaboration goes on with their caregivers, their parents, families, other health providers, which can include their GPs, specialists, dietitians, speech pathologists, oral health therapists, occupational therapists, social workers, their case managers. This is a big team involved, and the questions will include such terms. Are you now familiar and knowing what to expect? When the team would be involved, when the questions would be there, you will not be thrown off. You are expecting such terms and such questions, yes or no? Their social workers, their case managers, their oral health therapists, occupational therapists, speech pathologists, specialists, dietitians, GPs, and then the caregivers and parents and families, right? Clear for everyone or not? These are the terms, these are the people which will be thrown in the history and the questions. Now, most important thing is first to also get which caregiver, which member is involved with consent. There could be multiple in these cases, so please get that information. And then make sure, it is your job to ensure that the family and the parents, they understand your advices and they are incorporating it in their oral health care plan. Their home oral care plan has to be taught to them. You must educate them how to provide them oral health care. So you will have to educate them on daily oral care routine. It has to work in pamphlets. It has to work in clear, simple instructions. But that the message is put across, that is your job to ensure. So no matter what tools it requires, verbal communication, pamphlet communication, written methods, multiple methods should be included, but the message should be clear, simple directions to follow, so that, and make sure that they are applying it, using it in between your appointments. So every time they come for the next appointment, you will check that it is getting applied. Your communication with the parent and your communication with the child is also the foundational stone of your relationship with the patient. You know that these patients will have challenge communicating, but they still have a way of communicating, right? You will ask the parents what are the methods by which they communicate. You will learn about your patient. You will show that you're invested and interested to communicate. So it is important for you to take out time to even communicate to your patient directly, and you'll not just bypass the patient considering they have intellectual disability and not involve them. That will make them even more socially awkward. Will it give them a comfortable feeling around you when you're bypassing them in every communication, talking just to the parent? Tell me, would it give them a familiarity or more trust relationship with you, or lack of trust? So the more healthier way of your communication with them, the best way of spending time with your patient will give you more trust relationship, because they will require more complex communication needs. So tell, show, do still works for them. Even if they have intellectual disabilities and challenges, these kids, they still communicate in one way or the other. So tell, show, do still works for them. Giving them breaks, asking them whether they are understanding, and reassuring them works. So these kids require a lot of reassurances from you. You have to give them extra time. You have to desensitize them if they have negative experiences. Does that make full sense? So, any professionalism cluster question, these are the keywords you're looking for in choosing the most effective communication method. Give me big yes and no's if it gives you a solid concept for exam or not. Your good communication will also affect the outcome of your treatment, because that will make sure that the child goes home, he remembers what you asked, he invests himself in also their oral health care, right? So this is important. Your role is as important as the family and the caregiver in such patients who have disability, right? So you will use clear language, you will not use any jargon. You will put all the key points in written record also for the family to take home and remember, right? So written information and verbal information both will be provided. You will engage with the support professionals, parents and caregivers also. You will give them a good home oral care plan in simpler, clearer instructions. And you have the responsibility that they are regularly coming for their review appointments, and that in between the appointments, the oral health care plan is getting applied. Now, what are the various conditions I'm going to be talking about? What are the various disabilities that you may be commonly facing in your clinics, or which may be commonly be in the background of the SBQs? So one is your autism spectrum. That leads to challenges in behavior, communication, and it impacts their oral health. They have sensory issues, right? Touch, taste, check, texture, sound, light, anything can trigger. And oral health maintenance, oral hygiene involves touch, involves taste, textures, temperatures, liquids, everything, right? So it requires dexterity. They may have self-destructive oral habits like bruxing, tongue thrusting. Self-injurious behaviors also can be seen in autistic patients, like biting gingiva, picking on the gingiva and biting the lips, etc. All these things in information gathering will you be looking out for? So the level of cooperation would be reduced, especially your sedation and nitrous. Nitrous especially may be compromised, because one contradiction to nitrous use is when there is lack of verbal instruction understanding. Yes or no? For nitrous, you require the child to have a verbal understanding of all your instructions, because nitrous is a conscious sedation. They require to be conscious. And how will you assess that they're conscious? With the verbal instructions and communication. Yes or no, please? Other than your cysts, other than your ear infections, chronic colds, and GI cysts, etc., you'd know that there is a biggest challenge to the nitrous conscious sedation, which is the communication challenge. So in fact, these disability patients, they become more challenging for nitrous or conscious sedation case selection. If behavior management with communication methods like tell, show, do, modeling, desensitization, if these methods, conservative traditional methods, are not working for them, then nitrous have to be omitted and they might have to go for GA in severe cases. Clear for everyone? Again, crucial exam concept. Yes or no, please? Are you taking important notes here? So how your management planning and treatment and evaluation clusters, now you're getting answers to those, right? So in autistic patients, you might find there is an increased caries risk, there is increased periodontal disease because of the poor oral hygiene, right? And then their oral habits can be self-injurious, their muscle tone can be reduced, so there can be malocclusion, there can be bruxism, all can lead to various oral conditions. So treatment plan should include diagnosis and management planning cluster concept. Here your way. You have to include positive desensitization appointments for them. Their first appointments and even in future appointments, subsequent appointments should work on creating a positive environment for your patient, right? For their families. And you, not just you, your staff members should also provide that same environment. How you plan the appointments, what are the timings, how you communicate, everything will benefit your patients who have autistic spectrum disorder. They will have intellectual disability, they will be challenged with learning, cognitive, and developmental growth, right? So they will have some issues that will affect their oral health regularly. But you will involve their parents. You will also keep a track of their medications, other systemic conditions, or any new symptom which is developing, which I covered in the first slide. All the information gathering, drug history, medical history, dental history, any new signs, their overall health, their nutritional disorders, you will acquire information of all of it. So most important, caries, poor oral hygiene, and periodontal disease would be a challenge. So you have to make sure that the patients understand, their parents understand what are their challenges, what are the findings, and what should be the appropriate management and treatment and evaluation, right? The other conditions that you may have is Down syndrome. So Down syndrome patients have an increased risk of periodontitis, right? Because they have neutrophil dysfunction. Everybody remembers this. I've covered that in the basic thousands and past paper classes also. There are classic oral findings in Down syndrome. So general health also, systemically also, Down syndrome patients will have cardiac anomalies. They are also at a higher risk of epilepsy. So anti-epileptic drugs increase the risk of gingival enlargement. Motor issues, fine motor issues, so compromised oral hygiene. They are also at increased risk of obstructive sleep apnea. Again, an emerging hot topic, which I'm going to now cover and talk about in the coming weeks for you. I'm acquiring the latest guidelines on that, the latest information on that. As soon as it's ready, it will be provided to you as hot notes as well as a class. So Down patients are at a risk of obstructive sleep apnea as well. And they have larger tongue mass, forward posturing. So those risks also can impact their oral health. Their important clinical dental findings include increased risk of periodontitis because of neutrophil disorders, dysfunction, gingival overgrowth because of their anti-epileptic drugs. They have overly retained primary teeth, so retention of permanent dentition, impaction of permanent dentition. Then there is oligodontia, so there is also you have missing teeth, conical teeth, malocclusions, and bruxism and attrition. And then the other medical conditions in such patients have cerebral palsy, again covered what findings would be in the thousands and past paper classes as well. Just reviewing it again here if you're not doing those classes because they're optional. The cerebral palsy, most importantly, has motor challenges. There are movement conditions involved. Got it, everybody? Cerebral palsy patient comes, you would have motor challenges. There will be movements, right? So those are the ones which should be treated by pediatric dentists. J, cerebral palsy situations have movement challenges. So your just behavior management of communication will not work for them. You got the answer for your question? Which will require referral. The cerebral palsy patients will require immediate pediatric dentist referral because the behavior management and the movement challenges cannot be taken care of in general dental setup. But you must still know what are the issues that they may be facing. So they have oromotor dysfunction also. Aldo Parkinson will not be seen in children. That's an old age disease, degeneration of the brain. So Parkinson would not be fine. Cerebral palsy is a childhood disease. We're talking about childhood conditions right now, right, Aldo? So they may have dysphagia again because of the motor challenges, masticatory functions. No, if it's a mild Parkinson, we have been treating those patients, right, for dentures and all. But if the denture is not coming well, Parkinson patients' challenges come with the denture fabrication. They're old. So yes, prosthodontist involvement is required. We have done those questions also on combination syndrome, Aldo, right? So there is gastroesophageal refluxes, excessive drooling saliva. They have TMJ disorders, motor disorders, coordination is challenging for them, communication is challenged. Fine motor issues are also there. How they're required to be seated and positioned and adjustments required. So that's why pediatric dentistry is there. You would refer them immediately. Everybody, crucial again, your management plan question sorted? Because Jay, you asked this question in the beginning, so you have the answer now. Then there are certain craniofacial conditions like cleft lip, cleft palate, right? Other Pierre-Robin syndrome. So other facial syndromes. All these patients have underlying cardiac defects. They have epilepsy tendencies, cognitive issues, speech issues, challenges with eating as well. More malocclusion, more missing teeth, structural defects on enamel also on other syndromes. So when you have children with disabilities, your number one step in an entire pathway, anyone can tell on the chat, what is the number one secret, number one protocol, number one underlying foundational stone for such patients? Direct exam question is a soft skill, not a scientific answer, but an extreme important soft skill, but gets answered. And every SBQ on this topic will have a question on that, is communication. Good oral health you will achieve in such patients with good sustained communication. You will report, you will communicate, you will monitor, you will involve the family caregivers. Your staff will also be involved. There other medical health professionals will also be involved, and the relationship should be maintained. Right? Everybody, is that crystal clear for everyone? The communication is the foundational stone in the management, planning, and treatment pathways of such patient. Then what is the pathway that is required? Once you have established that your communication is the key, you will first start, the management plan will include how will you improve access to their service, because they suffer with access to services. Yes, that's their biggest challenge. Coming for the appointments, how they can access, they may be on wheelchairs. Is that right or wrong? Who is the person who provides consent? Whether it's the parent, whether it's caregiver, whether it's their caseworker or case manager or multiple people involved. Do they have any oral care plan or home oral care plan that they can bring with them? Those are the questions you will be required to ask, and that's how you start their treatment plan. Do they have any other protocols which have been prescribed by their GP or their dietitians or any other allied healthcare workers, physiotherapist, occupational therapist? If there are other protocols which have been advised and you may utilize those protocols for your communication, please ask for that. Is it making clear for everyone? Ask for consent, ask for protocols provided by other healthcare professionals. Number 2, clear for everyone or not? Is there any modification in diet? Because if your advices counteracts the other professional advices, that should not happen. The communication should be effective and non-confusing for the patient and the parents, and should be coherent with the other protocols provided by other dietitians or other healthcare professionals. Well, example, Meenakshi, would include any modified diet that they may require. So you cannot give a dietary advice if the medical specialist has particularly advised a particular diet, right, Pinakshi? So you cannot go against that diet. If the patient is on liquid diet, you cannot, should not promote a solid diet. Is that right, Meenakshi? That's number one example. Other thing is their current medications. If there are oral challenges with the medications, then you cannot counter advise to eliminate those medications. Then modify toothbrushing if required. That should be your advice. So you must document clearly what is your advices, and it should be coherent with the other professionals' advices. Clear for everyone? I'm now explaining the full treatment and evaluation cluster. This starts with consent, getting and knowing what are the treatments of other specialists, because that's the barrier, right? Your treatment plan is not just alone your treatment plan. It has to be networked with, connected with the other specialists treatment plan. Clear for everyone or not? This is where it gets layered. This is where it gets challenging. You have to ask Simmer who has the authority to give the consent. Usually the health professionals don't have the legal authority. The parents, the caregivers, the case workers and social managers, they are the ones who have the legal capacity, right? Got it, Simmer? So these are the questions that you have to ask. These are the questions that you will get in exam. And choosing the correct answer will come from this lecture. Now, you started with the consent, you started with combining your advices with the other professionals. Other is pre-planning. You can't take this as a regular day-to-day case or a patient. There has to go a lot of pre-planning. You cannot assign a longer treatment. You have to have shorter appointments. You have to also give them extra time to explore your clinic, explore the space, right? Even before their first treatment, you might have to have a familiarization appointment. Then you can have phone discussions with the parents, with the carer, that how they can prepare their child while bringing them, right? You can educate the parents how they can educate their child, what to expect, right? Give them certain tools, whether they are brochures, whether they are videos. Then what are their support plans? If the child has been provided a behavioral management plan from other specialists, please ask for that, because that will help you your management and your communication. I'm going to talk about it, Charmi. Let's hold on. Hold on. Okay, we are going there. We're getting there. All your questions will be answered. So you will ask for whether they have any plan or not by other professionals. Ask for that. And that's called their oral care plan. Because sometimes medical practitioner dietitians also give basic oral care plan, which can include their diet, right? Social and medical history would also be considered, and that plan would be given. So create a plan in harmony with that plan. Then you have to consider the appointment times which are quieter. There is ease of transport and parking. Would you call these patients in your most busiest hours when your parking space is a fight and there's no slot in the parking slot, lot of waiting time? Would you recommend those appointment timings? That will build up anxiety, that will make it difficult for the patient. So good planning, good familiarization, and regular preventative appointments can minimize the reliance on chemical or drug related restraints on the patients. Like you won't have to rely on all the time GA if you establish these protocols, which is good planning, good familiarization, and regular preventative appointments can minimize your reliance on sedation and GA. Do we want that or not? Do we want to expose this patient every few months to GA, every few months to sedation? Doesn't that have its own systemic challenges and side effects? Yes, right? So, extremely crucial. Preventative appointments, good oral home care, they all can combine and lead to minimal disease prevention. And then when they come, you will also have assessment of them, you will evaluate them, and then you will see that the risk factors are reducing. So you must also see that your transport arrangements for the child are also being met. Your clinic should be wheelchair friendly. The main entrance should also be the width of your doorways, the stairs, your toilet facilities. Everything should be able to accommodate such patients' requirements and needs. Right? Is there parking available? Do you have reserved spots for them when they come? You have to ensure that. Looks like a very tiny thing, right, when you talk about it, but for your patient it means the world to them. It eliminates the challenges, it eliminates the triggers, it eliminates the anxiety and reduces it, if not completely eliminates it. So your proper pre-planning and giving these support to your patients will help get a better outcome of your treatment. Now, do you see how soft this can get? That these little nuances which you may overlook, but when given in options in exam, become the foundation of your correct answers. So when they are in your clinic now, you will interact with the family members, carers, and support professionals, right? You will ensure that all the information is provided. Then you will start communicating with the child also, right? So you will have a wholesome communication, introduce them, talk to the child as well as parents throughout the consultation and also in future appointments. You have to explain also, not just inform, but educate and explain to the patients. You will also educate them about the home care management. So home care plan, home oral care plan, which is coherent and in harmony with the other professionals plan should be provided. So give them the appointments also in the correct timings. And then about the payment, because there is a lot of financial burden on these families, ask them whether they have their funds coming through NDIS plan. Will you remember this? This can be asked in the exam. Very important concept. NDIS plan, your disability insurance plan. Clear for everyone? There's a national disability insurance. If the parents are unaware of that, is it your responsibility to educate about this plan or not? Because they can get the financial support through these plans. So there is a case by case basis on which they get the help and the funds. So what is the diagnosis? What are the outcomes? What is the level of support? But there is a national scheme available for disability. There is an insurance scheme available, which can be a direct exam question. So from the consent to the financial assistance, everything in between, giving them the dental treatment is easiest. So we are not talking much about that here because you know the dental part of the treatment, but the other part of the treatment, and those are the part of treatment and evaluation. They are the part of management planning. So see how layered and complicated this can get? Now, what if they bring their assistant dogs or assistant animals? So there are three situations under which a dog can be allowed. One is when the patient has a disability and they have an assistance dog, which is also known as service dog. So service dog is in all situations, all scenarios allowed in your clinic, even in the working area on the chair. Then the other situation, it would be a pet, which is not at all to be attended or allowed in the clinic. You are under no obligation to accept the pets. Service dogs, assistant dogs, yes. Pets, absolutely no. And a therapy dog, which is another situation where the clinic owns the dog and allows the patient to interact with the dogs. In Australia, not popular, not promoted, not suggested, strict protocols, strict guidelines, avoid the therapy dog. Come here in the North America, many clinics you will find with the therapy dogs. So rules are different, but in Australia, the guidelines are stricter and not promoted, allowed. Clear for everyone? Assistants, service dogs allowed. Pets, absolutely not allowed. Therapy dogs, there is a gray area around it. So the guidelines are mostly recommending against them. Assistant dogs are allowed because they are rigorously trained, right? And they help people with disabilities, especially with epilepsies and sight loss, right? They help the patient get better management of social situations for their functioning. So these are permitted in practice, including clinical areas with the patient. There is no obligation to accept the private pets or staff members or the patient's pet. Now, therapy dogs, usually they are owned by clinics and they help certain patients feel better, but there are challenges because there is a possible risk of infections, MRSAs, and salmonella and other bacteria and other species which are potentially infectious. That is why there is an increased risk that when the dog licks the face and there's, the patient may be immune compromised. So there are a lot of legal risks involved. See, there can be the personal injury to the patient or staff. There can be the practice owner who has owns the property, or if it's a leased property, there is also a risk to property and damage to the property. If maybe the landlord who owns the building doesn't allow that, and there can be adverse health reactions, immunological reactions, allergy to dog hair, those kind of allergies risk are also involved. So do you get a clear idea on the assistance animals as well? Now, are we ready for the SPQ? And you are now going to give me the answers by applying the concepts that you just learned in this huge lecture. Thank you for putting up with this such big lecture today. I know it was intense, but I'm sure you gathered, assimilated, collected so many direct exam key points. Give me big yeses in all caps if you can, if it made sense from your information gathering to your professionalism and health promotion in between your diagnosis, management, and treatment evaluation cluster. Now let's talk about Sally, who's a 14-year-old patient, presents with complaints of tooth pain. There is positive tenderness on percussion on a particular tooth. She recently acquired a service dog named Kiko, and she was emotionally dependent on her. Considering her emotional dependence and the nature of her condition, how should her treatment be scheduled? Now, one thing that you will notice here is the keyword of the chief complaint, right? Everybody focus on the chief complaint. If there is an emergency situation, now tooth pain is an emergency situation. So when managing and planning the treatment for such patients, we know there has to be communication, familiarization, behavior management, a lot of things. but the emergency has to be attended. Yes, scheduling her treatment after school hours to provide a more comfortable appointment should be from the next appointment. But today, now when she's here, you can do a minimal emergency treatment of at least pulpotomy, right? So that she's completely pain free. Because she would be having a lot of medications for her challenges. You don't want to add the further painkiller load, further medication load, and minimal emergency treatment should be done. And then the later future appointments should be scheduled after school hours to provide a more comfortable environment. You will not treat her as any other patient during clinical hours. You'll not postpone the treatment until later date to ensure proper preparation. That could have been done if there was no emergency chief complaint. Does that make crystal clear sense for everybody here? For all the 4 options given, best answer would be C. Now these are your exact exam questions. And this, now you will see when you're answering these questions, how this lecture has fully prepared you for these questions and even more variations like these. How should you approach her treatment plan? You will explain the procedures in technical terms in detail to her and her guardians. You will provide holistic care, addressing her emotional and physical needs. Involve her parents and family members in decision making, especially if treatment is scheduled after school hours. Give me now ABCs because these are very tricky, very close, but there is a clear winner if you understand the foundational concept, foundational role. Now that's wrong there. It's not C. Anyone, did they get it right? Let me see. Did I see any A yet? No. Yes. Okay, now A's are coming in. So the best is A, not C. Sneha, why? Let's see. See, involving the parents in decision making. Decision making is what to do, right? Yes or no? Decision making is, oh, you tell me, should we do this? Should we do that? One thing is that. That's the way of communicating when you're involving somebody in decision making. Oh, help me decide. Well, it's a good thing, but is it enough? Explaining the procedures and technical terms, then it helps them in decision making. Just involving isn't enough. No, explaining the procedures and technical terms would be that you're not just saying jargons and breaking it down to the layman terms. This is the advised method. Yes or no? That is why it said that explain these terms. If you're saying the child has caries, you will explain the procedure, you will explain the technical terms. This is opposite of what you're saying. You are not saying the technical terms, you are explaining the procedures and explaining the technical terms, which is beautifully said, Muna, is the basis of tell, show, do technique. Right or wrong? So that's how the exam gets tricky. This is your level of trickiness in exam. Straight in your face, right there. But you will get confused with language. Erica, the answer would be A. B is a very generic statement here. Holistic care, addressing her emotional and physical need. Very generic. A is exactly how you're going to address and manage it. C is just involving but not explains how. C says yes, involve them, collaborate with them, but not how. A means that collaborate with them and how. Does that make sense? It will not be very in your face all the time. Agreed? These are your code of conduct, communication skills, the soft skills. Clear for everyone why the best answer would be A. You will collaborate, you will communicate, and how. And involve both the child and the parent, right? Now, the bite wing shows there was a mesial decay on forceps. There was also horizontal bone loss. There was C1 and C2 level caries on 1.5 and 1/6 which are not reaching clearly in dentine yet. So what's the most likely source of her pain? She has spontaneous pain and also tenderness on percussion. So 1/5 and 1/6 is not the source of that pain. Whether enamel caries of C1, C2 can give you TOP or spontaneous pain? Can it? Absolutely not. So that's why the mesial caries on 4/6 would be the possible source. Periodontal disease causing bone loss, well, will have a very mild discomfort, doesn't give you immediate localized TOP, tenderness on percussion, and spontaneous pain. Food impaction and lodgement also gives you that pressure feeling, but not immediate TOP and spontaneous pain. The caries, which is mesial cavity on 4/6, is leading to that pain. So best answers A. Now you diagnose it with irreversible pulpitis because there's spontaneous pain, which is also in later stages spreads to the periapical area. Is that true? In later stages of irreversible pulpitis, it spreads to the periapical area. Is it or is it not? So if there is irreversible pulpitis, what factor would you consider when you're planning her endodontic treatment? At the age of 14, and it's the 6 that is involved, what should be the status of the root? So is it still in the developing stage? Furcation not formed yet? Root is fully developed or is fully developed but has narrow pulp canals? Well, in the early stages, the canals are wider, right? As the tertiary dentine and secondary dentine deposits, then the canals get narrower with age. Is that right? So A, B, and D, all three ruled out for being incorrect. And C is your best answer here? Yes. Why is placing a dental implant not a suitable treatment option for such 13-year-old patient? Well, the craniofacial skeleton is still developing and that can affect implant stability and position. Is that a correct statement? Why we do not give implants in developing patients? Patients' oral hygiene is not adequate for implant placement. Even if the oral hygiene was adequate, being in the developmental stage, the implants are contraindicated. So B is ruled out. Implants are only used for cosmetic purposes and not functional restoration. That's incorrect. They do provide functional replacement, but not at the developmental and growing age because the bone and the bone sizes, yeah, they are still developing. The patient prefers other treatment options. It's not about preference. I got a lot of E's, so let's compare it with the E. Implants are contraindicated in all patients under the age of 18, regardless of the growth status. Well, that's untrue. It is usually not advised in the patients under the age of 18, but anybody who's done the program, if you've seen the case in clinical cases in prosthodontics by Jahangiri, there's also a case given there. In younger patients, especially with syndromes, sometimes implants may be given. So in all the patients is a definite term, so that makes it incorrect. And regardless of growth status also makes it incorrect. Suppose the patient is 17, but on your wrist x-rays and other x-ray analysis, you find that the growth is completed. Then at 17, you may give implants, especially when severe syndromes are involved, severe challenges with the nutrition and chewing is involved. So understood everybody that E is wrong because growth status is extremely important, Halima. Yes, absolutely right. Growth status is important. Age is not just the only criteria. If the growth is completed, then you may go for implants at 17 also. So it's both the criteria which should meet, right? And in certain younger patients also, some implants are given, right? So best answer would be A, that craniofacial skeletal is still developing, which can affect implant stability and position. That's why they are not a suitable treatment in a 13-year-old patient. All right, so that would be it. And thank you so much for your attendance, for your attention, for your engagement, for your interaction, and learning it so well. Thank you so much. And the good news, the most awaited news is that on Thursday internal class, we start the Ultimate Advanced File Volume 2. The Power Notes will also start following up. So with your existing Hot Notes and existing Power Notes, I will release Power Notes Volume 2, right? So on Thursday, we start our UAF 2. We start making the Power Notes on them. A lot of learning coming up, and the cluster specific mocks are coming up. So today me and Apurva are going to create so many quizzes, so many mocks for you. Soon on the app, you will start seeing on the quiz section at least 40-50 more mocks added. And two extremely latest new health promotion and professionalism mocks are also going to be released. So there's so much coming, so much new and exciting waiting for you. So yeah, it's gonna get more interesting now. The 12 weeks that we are at, they are going to be all the revision period. That's why I always say, whoever joins me, first 8 weeks, you bear with me, you put up with the intense program. I know I make you sweat. I know I make you cry also at times, but I tell you all the time, just bear with the program in the first 8 to 10 weeks and then see the magic happening. Then you start teaching me, then you start applying all the concepts. You bring the more information on the table. That's the beauty of the program. First 8 weeks you give to it, and then the next 12 weeks it gives you the confidence, it gives you that grasp that it's just magical. So now I'm sure the 12 weeks are the easiest part of our program, where it's just quick revisions, quick rewatching. Everything is on the rewatch stage now. And please also remember, cannot emphasize enough, 5 times revision of TG, 5 times Odell, at least 3-4 times code of conduct, 5 times ICG, then 5 times trauma guidelines. Mocks are there, but for every resource you have mocks, right? So everything is supported and backed up by the mock examinations. So everything you're reading, everything you're watching, whether hot notes, whether power notes, or the CD classes, special topic classes, all the lectures and webinars, and all the hot notes and power notes combined together, and with your practice mocks. That's your excellence, that's your success there in your hands. Backlog is natural joy. No, don't worry about it, because now the 12 weeks is all about repeating, all about revising. You have the scope to cover up and catch up your backlog, right? And the app is so flexible, so intuitive, right there on your fingertips. Everything is available to you for multiple views, multiple attempts, multiple reading. So when the tech is with you, when everything is made available for you, everything works for you, not against you. The program works in your favor, not against you. So backlog is just the matter of time. Give more time. You have everything available for your convenience. Esther, backlogs is just the matter of time. The quizzes, the assessments, the notes, the classes, everything is there for you. Utilize it. Get the backlogs covered. Invest more time. Take few days off. Sit down. Watch the classes. Read the notes and take the assessments. Okay? Why is it taking time? Please watch on a faster speed, Halima. Right? Halima, you're the full course or the crash course? If you're full course, don't do the 7 to 8 hour. Oh, you're March 26th. Do the 7 to 8 hours, Halima. Spend time. Focus on every single class, thousands and past papers for very strong foundation. So if you are a dual course candidate, please take your time. Right now, backlog should be the last thing on your mind, Halima. You have 10 months to go for March. Take your time and do the 7 to 8 hours plan. And the 7 to 8 hour plan, don't finish in one day, even if you finish it in 2 days. So spend 4 hours and just cover it in 2 days. You have all the time, utilize it really well. That is why I encourage people to join the dual course because it gives them the full grasp of the syllabus. For September 25J, last Tuesday, I covered how to and what to study in the 12 weeks. Did you watch that class, J, yet? It was uploaded on the app. If not, please watch it. It will give you the full overview of what to do and what to focus on the 12 weeks. And every day I'm putting on the study buddy group your reminders to what to revise and how many times in these 12 weeks, Jay. Are you following with that also? So keep sending me questions, keep asking your doubts, keep asking questions, keep interacting with me. And also the reminders that I send you on the study buddy group, take them very seriously, guys. Okay, and now the most adventurous journey begins, the second half of our program, the Ultimate Advanced File Volume 2, where you have greater learning, much more interesting concepts, and newer references, newer articles, newer hot notes will be coming your way. So you know that the Power Notes Volume 2 is coming. Also, some new hot notes will also be added, as we'll see newer concepts. In the UAF Volume 2, I will create simultaneously newer hot notes also. Although I think there would be only few topics to add, but Power Notes will be entirely created for the entire UAF Volume 2 for each question, as it has been provided to you for Ultimate Advanced File first volume. Any more questions, please drop me a message on WhatsApp. Won't keep you longer. You had a great, tiring, very intense lecture. Sleep on it. Let it sink in, all the information. Yes, Neha, that's the beauty of it. You're stressed because you're working hard, because it's important for you. If it wasn't important to you, it won't stress you. And you're excited because there are cluster mocks coming up, there are new power notes coming up, UF Volume 2 coming up, so many revisions and such great confidence waiting for you. So I understand all the emotions that you go through and I share them with you. I also go through the same roller coaster every 5 months with every batch. So I'm with you every step. I'll see you on Thursday. We'll learn and apply more of the exciting rash technique and see how this key works every single time. Have a great evening, guys, and sleep well. Do not go into the scroll hole. Do not go into social media and just distract yourself. Let the information stick with you. You can revise it all, and you can go to the hot notes now of this topic, children with disability, and now you will see everything instantly making sense. All right. So thank you so much. Good night, guys. Thank you, Hannah. Yes, it's absolutely is the ocean. You are swimming in the ocean and you are collecting your pearls now. So, absolutely. Thank you so much. Truly grateful for each one of you. Have a fabulous evening. Thank you so much. Bye bye, guys. Thank you. I'll have a great day myself. Thank you, Charmy. Thank you so much, everybody.